Hi, welcome everyone. My name is Warren Matofsky. I'm one of the clinical leads in CAMHS and also someone that specialises in group work. And welcome to this Introduction to CAMHS Group Therapy webinar where we'll look at two things: working with online group dynamics and assessing suitability for CAMHS groups. This webinar will work best if at various points where I invite you to pause and try some exercises that you have a go at them, not least to prevent my voice sounding monotonous if it hasn't already. I want to start by pointing out that this session has had to massively change this year because the way that we're delivering groups has kind of radically changed. And as someone that over 30 years has run groups with children and young people, with parents, and when I'm feeling particularly brave, with multiple families, I feel a tremendous sense of loss that I've not been able to bring groups together in a way that I traditionally have. Now, I've run groups in some really challenging circumstances, whether that's over the last 10 years of austerity, where we've had increasing CAMHS referrals and less time for group therapies. I've run groups in war zones and also in regions where there's very little functioning state apparatus. But in all those contexts, I've always managed to kind of get people together into a room or in a defined physical space to kind of explore how we can develop by coming together as a collective. So as I said, that's kind of a significant loss, and in bringing together the materials for this webinar, but also in doing the literature review and reflecting on my online group practice over the last 6 months, I've tried really hard to make sure that loss doesn't cast a shadow and doesn't push me into minimizing the possibilities of online group work or over-egging the limitations of online group work. But I would say the kind of take-home message from this is that online groups are different, and when they appear similar, it can be for different reasons, but we'll kind of get into all of that. So a theme I talk about a lot in these seminars is that we must think about the reality of groups. There's lots of myths about groups, and we'll get into some of those in a while, but it's really important we engage with the reality of groups and what that means at a particular time. So in terms of the idealized groups, the hopes that people have for groups, and what I find is that when I get a group of CAMHS staff or senior managers together to talk about groups, it's very easy for all of us to get overexcited, not just to build castles in the sky, but kind of build entire civilizations. We get drawn to the possibilities of togetherness, shared learning, how somehow groups can be kind of more efficient. As opposed to seeing one person, I'm now seeing 8. A discussion which often forgets how much work it takes to pull people into a group, to sustain them there, and to produce all the materials for a group. You know, we're combined to the idea that it's really smooth coming in and out of a group, that staff can share their practice. And while those things are all true kind of some of the time, we need to take a more rounded approach to groups. And you know, if you want to learn more about the possibilities of groups, then people like Yalom have written about them extensively. But in terms of the challenges of groups, I think the best research, even though it's 60 years old, was, you know, the work done by Wilfred Bion, and you can read his quote there. But I think what Bion was getting at was the fact that the developmental potential in groups is always vulnerable and kind of fragile. So let's think about the dangerous group, the challenges about groups. Well, first of all, this cultural theme about the fact that individual therapy is always superior. I'll talk a bit later about how we can kind of respond to that, but that view is certainly out there in the public and possibly in our staff group as well. The other side of the dangerous group is that you can feel really lonely in a group. You can feel ignored in groups. Groups can get involved in scapegoating. You know, the group might turn into a gang, and maybe that's a particular fear in working with groups with young people. As many group workers will tell you, you can often get quite a lot of dropout from group, which creates challenges. And for our time poor staff, how can they find the capacity to invest in a group? And we'll also have our own preferences about individual and group therapy. The other issue on this side of the discussion is a place that I think of that's called the CAMHS group graveyard. And if you look at those gravestones, they're all on them. On those gravestones are kind of names of groups that have started and have fallen by the wayside during my time in CAMHS, some by me, some by colleagues. And we have to be aware of the attrition of groups and what we can put in place to ensure all the energy and commitment that we put in our groups allow them to be sustainable. So in this session I'm going to present a lot of the research on online groups, but one major limitation of that research is it was done with groups where people chose to be in them. They chose to kind of work online, and that's really different now, where people may not have a choice about joining an online group. And I think this was captured really well in a book by the philosopher Zizek, which he wrote a book about COVID, which amazingly came out at the start of April this year. And he made the point about working under COVID is a bit like the person that goes to a cafe and asks for a coffee without cream. The waiter goes away and then comes back and says, "Sorry sir, you can't have a coffee without cream, but you can have a coffee without milk." So it is different working in online groups when you don't have a choice. So at this point, what I'd like you to do is to just pause at this slide and have a think about your experience of online groups over the past 6 months and how that's different to groups in the room, and think about differences, losses and kind of possibilities. And I'll give you take a bit of time to have a bit of a think about that. So hopefully you've had a bit of chance to reflect on some of those differences between online groups and live groups, or as I put it, the difference between screen and circle. These were some of the ones that I kind of came up with to start off with, thinking about the boundaries, the main boundaries of our group work: time, place, space and confidentiality. In terms of when we're working live in the room with a circle of people, we know that we open and close the door, and that's the kind of and we have clear external boundaries of the room. On the screen it's very different, because the internet does not have a beginning and end. And in terms of managing boundaries of space, when you're managing the boundaries of something that doesn't have a beginning and end, that's going to be much more challenging and require much more of our time to think about. Another one that comes to mind is the cognitive load of screen time. I'm sure many of you have noticed that during online meetings, and so often when groups are run online they tend to be briefer, and there'll be all sorts of consequences, intended and unintended, that flow from that. You might want to think about those other categories I've put down there and have a think about how they're different in the room and on the screen. So whilst to some people watching this webinar it might be quite new working online, there is 25 years of research that we can draw on. And when you look at the research, and I've done from the literature review I've done over the summer, there appears to be two schools of thought. First of all, we have the technique camp, and then we have the relational camp. And while dividing it up into two schools of thought are handy for a slide, what I would say is really those two groups of researchers have been trying to answer slightly different questions. So in the technique camp, the questions they've been asking are really about how you use the online medium and having a group of people connected in the online medium to engage individuals with particular tasks. And they've come up with lots of kind of ideas about how that might be done. The relational camp have tried to answer a different question. They've been answering the question about, is psychoanalysis possible online? Can you have deep relational contact when you're working through the medium of video conference or other forms of group gatherings online? More recently, Chaim Weinberg has pulled together a more integrative approach, and a lot of his research started off with online listservs where people post messages, so the communication is not happening in real time. And more recently he's gone on to research online video conference groups. And in presenting the materials about online group dynamics, I'll be using CAMHS framework for describing online phenomena. So let's talk about synchronous e-groups, and one example of a synchronous e-group is the video conference group that I think a lot of us have either started or hoping to run in mental health services. The starting and most important point is the duty of care, how we can generate safety for participants in the group but also for therapists, not least when we're managing a medium that doesn't have a beginning and end. And it's really important that not just the people in our groups feel contained, but us as group workers feel contained and clarified about what the boundaries are and what the challenges are in managing them. A big part of that, and I'll only mention this briefly, is the role of software. There's a range of software that we're using at the moment in CAMHS, whether it's GoToMeeting, the use of Zoom, or the use of Skype. In exercising your duty of care, it's really important that you've had a chance to practice on these platforms, talk to other people that have used them in groups to learn from them. If you want access to training and support around the role of software, either contact the IT help desk or look in the address book for webinar support, and they can advise you on how to access those particular softwares and get training on it. The next point is about the fact that how we behave online and how we behave and work in the real world are organised by some different rules. And online there's this thing called netiquette, you know, the good manners of how to operate online. And as someone moving into running online groups, it's really important that you know your basics. So I'm sure you've all had experience of the netiquette around using the mute button, but there's lots of other things as well, and you can get into that in various ranges of detail, going down into the, you know, the cultural meaning of ghosting someone in an online chat. What I would say is, you know, go and ask Grandma Google for some information about netiquette, but also use your group to help police this. Often young people might know more about this than us. Well, let's use their expertise, and in the group let's bring them into helping the whole group regulate how they apply the rules of netiquette. And also, if you're a novice to this, don't worry, because your lack of knowledge could be a source of curiosity, and you know, just checking in with the people that you work with about how we can do this, what are the rules, so we can do our best to, as we do in live groups, try and share responsibility with group members for appropriate conduct in the group. The next point is that projection online is massive. So this is the point where I'm going to ask you to go away and do an exercise. So what I would like you to do is write down what you think of as a simple one-sentence definition of projection. Now, you might be tempted to just think that in your head. That's a slightly different exercise. It's more challenging to put it down in words, but just kind of have a go. And when you've done that, I'd like you to compare that with the definition on Wikipedia, or if you can lean across your desk and get that Dictionary of Medical Psychology, see how that compares with your definition. Okay, so hopefully you've had a bit of a chance to go away and do that, so you have a sense of what projection is. It is all over the place online, and that's because we do not see the other online. We just see an image of them on a flat screen, and so the tendency is that we will fill in the gaps of what we don't know and we don't see, or we might position them as the other or not me and draw on all sorts of stereotypes and social discourse to fill in those gaps. And one of the things shown up in the research on synchronous e-groups is that while it might superficially seem like we're in a small group, it's more like relating in a large group, and I'll say a bit more about that later. But in large groups there's a tendency to fall into two defensive poles that were explored by Turkey. The two poles are: one is the fantasy that we're all the same and we might deny difference and cling to togetherness. Inevitably that is fragile, and it might tip over into the other defensive pole where we might feel lost in the crowd. We might feel alienated, and then that can lead to withdrawal from relationships. And one of the things we find in the culture of online groups is something called the culture of lurkers. That's people that sit on the edge of the group, watch what's going on, don't share much with the group, but are observing everyone else's communication. Now obviously we get those in live groups, people that aren't actively participating but are present. But I would argue, and the research seems to back this up, that that's in some ways more straightforward to manage in the room, whereas online lurkers will tend to be ignored until brought into the conversation. Next thing online is that we have the loss of mirroring. Mirroring is a key process that happens in groups and structures interpersonal contact within the group. If you want to have an experience of that, what I would suggest you do is the next time you're in a team meeting or other group where this is possible, ask everybody on the video call to give you eye contact. And what you will find is that they do it in a whole range of ways. Some look at the screen, some look at the camera, some look to the left, some look to the right. And so the way that paired communication, the way that eye contact between individuals in a group is very different online, and that sets up very different dynamics which may be helpful or unhelpful. And online we have fewer senses, and so the ambiguities of communication can be kind of much harder to tolerate, which can create all sorts of defensive communication. As well, we know without the presence of flesh and blood there seems to be less moral restraint. This is something that's been really significant in research on ethics over the last 30 years since Levinas, and their idea was that moral responsibility for the other begins with seeing them in front of our eyes. This is kind of really deep stuff, and what it can mean online is that you might get aggression or insult without guilt or remorse. So we're all aware of the culture of trolling, which I would argue is not just kind of about anonymity. You know, for example, go and look at either your child's, or if you don't have children, a niece or nephew, look at their school's Facebook page and look at some of the things that parents might say on there. I don't think a lot of that would be said necessarily at a parents' evening live in the room. And this relates to a well-documented effect called the online disinhibition effect, the way that their communication might be more disinhibited online. That can sometimes be experienced that people share more online and are more open and give the impression of kind of greater intimacy. But sometimes after disinhibited communication, after the session, you know, maybe people might feel more shame. And so we want to think about, you know, what the endings of our groups, how do people leave groups, so we can kind of track the impact of some of that sort of communication. The reality of e-groups. So to me, one of the significant therapeutic factors in live group work is about the kind of intimacy you generate, and how is that possible online. You'll see there in the photo in the top right hand corner that famous scene from the movie Fight Club of the testicular cancer support group, and how intimacy was set up in that group. Great film in terms of kind of group process, large group process, even if it was slightly amoral. So this question is, how is that possible in online groups? And you'll see the kind of sanitized version of people working online in that slide at the bottom. So thinking about intimacy in the room, that's about privacy, about self-disclosure, about lower personal boundaries, about the kind of interpersonal connection and mirroring you get in groups between different pairs and different individuals. What we know from the research, that in live large groups that intimacy tends to be more inhibited. And then as we move online, Chaim Weinberg came up with this notion of e-intimacy in order to differentiate it from intimacy in the room. And you've noticed he's put a copyright symbol afterwards, and I think he did that self-consciously to reflect the fact that when we're working online, our experience is mediated, is increasingly commodified. You know, this is brought to you by PowerPoint and Microsoft PLC, and also that e-intimacy is increasingly marketized as well. But what does e-intimacy involve? Well, it's about belonging, about togetherness, more shared rather than connected. A large group with the illusion of a small group, which might be based on a fantasy of similarity, but may be regulated by kind of web rules. So have a think about the kind of intimacy that is possible. And in generating that intimacy, you know, the research suggests it's useful to think about these 4 key barriers in moving from circle to screen. Losing control of the setting. Obviously we don't control the person on their webcam, and that's going to have all sorts of consequences, not least in ensuring people aren't recording what is a confidential session. The disembodied environment, we're looking at screens. The question of therapist presence. How can I be present to my group online when I can't have paired eye contact and all the other things I can do when I'm in the room? And lastly, the question about ignoring the background, and I'll go through each of these in turn. So the setting. Who is responsible for the setting? Well, this is all about how we can ensure safety, confidentiality, and crucial to that is preparation. So as I mentioned there, how can we ensure that sessions are confidential? Inevitably, this is about a shared responsibility. We can't go around into someone's room and check they're not recording what's going on in our sessions. We have to do the preparation to do everything that we can to ensure that our duty of care and safety is possible. And how we can bring everyone in the group to being involved in this shared policing to ensure that we're all feeling safe. The next is admittedly a concept that comes from the group analytic literature, this idea of dynamic administration. What that means is that how as group facilitators we attend to the minor details and practical details of the boundaries sets the culture of this group, has an impact on how people experience the group. And so as leaders, it's part of our role to develop that sense of safety, continuity and integrity of space. And we can do that by careful attention to detail of how meetings are set up, how they're beginning and ended, and also, for example, showing confidence with how we manage software bugs and that we're ready for that. So in terms of overcoming the loss of the room, here's some kind of pointers from the literature and what I've learned in my own practice and supervising others over the last 6 months. Prepare group members well and having an explicit contract. This can't be emphasized enough. And for people interested in seeing the sorts of contracts that are being used, I'm happy to share some, and please get in touch with other group workers in your part of the service. You need to be clarity about video and audio. So when I'm running an online group, I will be asking everybody to use video. There may be exceptional moments where someone else's confidentiality is breached, that might have an impact, but we also need to check out about what location people have and what privacy. So for me, being on a mobile phone in the back of a car is not acceptable. That doesn't guarantee that kind of confidentiality. How we can set that up and ensure that people are following those procedures. And then there's also something about departure and follow-up. You know, it's complicated online. People can leave for all sorts of reasons, not least the kind of bandwidth and kind of connection bugs. But you need a clear policy about how departures will be managed, and where people don't come back, what the follow-up will be. Will it be a call to them? Will it be a call to their parents to check on safety? And thinking those things through. The next issue is how people look at the screen. So I've had lots of feedback from young people that they don't like, when they're in a video conference call, seeing their own picture there for all sorts of reasons. And in a parallel way, as a group facilitator, I can find seeing my picture amongst the group faces quite distracting. I don't have that live in the group. So what you might want to do is explain to yourself and to others that there are options for turning off your video view. The last thing, and to me this is really important, is about focusing on the platform that's delivering the group. So getting explicit sign up that people turn off their apps, close their mailbox, not have pages open, and if it's possible turning off their phone, so that focus is on the group platform, which can also encourage confidentiality. So number 2, disembodied groups. I'm very aware of this now, staring at a slide on an empty screen, not seeing your faces. And there's a lot of loss here. We've lost the body, that body-to-body communication and co-regulation that's that's there all the time in our live groups. We also have the loss of the gaze. Participants in your group can't see a therapist is looking at them or a peer is looking at them. How you get empathy and support in the group will be different. And we also know that affect regulation can happen through somatic, physical and emotional presence, and that's no longer there. But it's not just about loss, it's possibilities as well. One thing we know about working online is that facial expressions become clearer. Now, sensitivity to changing faces on a screen, that is a skill, but you can start practicing it now in all sorts of groups. When you're there, try tracking what's happening in other people's faces, how you can read them and how you can use that information in the group. And you also might want to think about rituals of contact via screen. There's one young person who I'm working with, and we had discussions about how do you end the session, who turns off their video camera first, which was something I was quite interested in. And what we do is, before, to mark the end of the meeting, me and this young person do a slightly ironic putting our elbow towards the webcam as the sort of as opposed to a handshake, to mark kind of the ending. But be playful with that. That's something that we can do. And as was pointed out in the literature, group conductors need to be more active online, asking members to report their body sensations and promote movement in the room, such as moving closer or further from the screen. I certainly take that last bit of advice a lot. You know, I'm quite a fan of scaling questions, and opposed to the sort of static asking somebody to come up with a number between 1 and 10. Sometimes I might get people to, you know, move their body closer or further away from the screen to answer a question, or, you know, getting them to move across the room behind them, and it just sets up a different dynamic and uses other channels of communication, which I think is kind of helpful in terms of managing the disembodied environment. So next, the loss of presence. So what is presence? Presence is that state of moment by moment receptivity and deep relational contact. So that's very different online. Online, obviously, you have the screen barrier. You have distractions for the facilitator and the member because of the things that are sitting around the screen that you're currently looking at. You know, you're always looking at everyone's picture rather than focusing on one person, and all of these things might dilute the presence of the therapist. Then you have the question of the chat function. You know, in some of the groups I run, I'm quite cautious about using the chat function, because if a chat message comes up while someone else is speaking, that could be experienced as, oh, you weren't listening to me, you were too busy kind of typing. So you need to be explicit and think that through. You know, maybe you're not going to use it, or you're going to use it at set times in the group. And then think about your choice of therapist appearance. Do you want people just to see your face? Do you want them to see, you know, more of your posture and your body, which allows you to communicate using a wider range of non-verbal cues? So what are the options in terms of managing this loss of presence? Well, to me, the big one is an active use of self. I find I'm working much harder in the group online, and I don't think that's just because I'm underselling its possibilities to myself, but you have to kind of be transparent. I use a lot more self-disclosure, sharing my experience of what's going on and naming things that can be kind of talked about. So that might include, I don't know, bringing the digital strangeness into the room. You know, perhaps, and I'd be quite cautious about this, but bringing certain facial expressions or movements or quietness into the conversation. Without bringing it into the conversation, it's less likely to become a topic for the group in the way that it might be in the room. Although sometimes in the room you need to bring it into conversation as well. Also, get ready to take responsibility for mistakes. That you as a group facilitator are prepared to take some risks, and if they don't work out, you can kind of own up to that. You know, that humanness of the facilitator, we know from the research live and online that goes down well with groups. And yes, an invitation to be kind of playful and explore the possibilities of the medium, and invite those in our groups to have a go at doing that as well. So number 4, working with the background. For some reason it says number 5. That's so you go away thinking you've had more content than you've actually had. working with the background. So I think this one is really about how we can generate more intimacy and more therapist presence. And what a lot of commentators have noticed, that we tend to ignore the background in online groups. What's happening in an immediate sight shot of the person looking at their screen. So we tend to ignore the background in online groups, making the culture less embodied, not more. So the idea is, how can we bring the background into the group? One group analyst talked about a session where in the midst of the discussion, a cat walked across somebody's webcam and nobody mentioned it. So he came up with this reminder to mind the cat, you know, bringing the background to the foreground and in the here and now. And if you notice something happening in somebody's webcam, it doesn't necessarily mean that you mention it straight away, but that just you notice that and think about how you can use it, how to bring an individual's context and your own context up for discussion. So yeah, pay attention to the background and recruit the group to work through it. So next, you know, however well you've kind of set up your online group, how thoroughly you've thought about how you're going to manage the online group dynamics, that doesn't mean much if you've got the wrong people in the group. So the next bit is about assessing suitability for CAMHS group therapy. So first of all, from our evidence base, we know that diagnostic categories are poor predictors of treatment response and prognosis. So my recommendation is that when assessing suitability for CAMHS group, you ask yourself, is the group useful for this young person from this school or educational setting or provider in this family at this time? And to help you answer that question, it's really useful to know what is the task of the group. Now it's interesting, over about 15 plus years I've been supervising groups in CAMHS, and if you wanted a supervisor for your group, get in touch with me, and if I'm not available, I can put you in touch with other group workers in CAMHS who can offer supervision. But at the first supervision session, I always ask, what's the task of your group? And that's one of those questions that sounds simple, but the answer, a concise answer, can be much more complicated. So on the next slide, I've kind of summarized this. And so for example, for cognitive behavioral therapy and mindfulness-based cognitive behavior therapy, which in CAMHS is largely run for the older age group, the task is to reduce experiential avoidance and promote psychological flexibility. And you know, often that group is about 10 plus or minus 2 sessions. There might be some parent sessions in there. And yeah, when you're thinking about who to include and who to exclude, yes, there might be certain problem types that group is suitable for, but what I would say is the one thing that is often missed when referring to group CBT and individual CBT is the second inclusion criteria there, the importance of motivation, and that the young person and the people around them have the resources to complete diary, worksheets and kind of practice issues. Similarly with DBT, there the primary task is to support the development of emotion regulation skills, but that comprehensive DBT package is a very resource intensive package. It expects someone to attend weekly group and individual therapy and parents to attend group. So it's really important that someone's commitment to attend has been evaluated, as well as, you know, that they have a high level of need commensurate with such a resource intensive group, so significant suicidality and long-term emotion dysregulation problems. Similarly with art therapy groups, you know, the task there is about exploring meaning and interpersonal relationships through creative media. And so thinking about young people for that group, we want to make sure that it's kind of young people who can tolerate the anxiety that such a group might generate. But yeah, in thinking about referring young people for a group, we want to think of where does the task of the group fit with the formulation or the shared understanding that you've developed with the family. Then you need to think about, does this young person in the family have the resources to make use of the group? Kind of, are they motivated? If it's a parent group, then think about the needs of the parents or carers. And if it's a young parents group, how they're able to access the group. Okay. And the next thing is expect a preference for individual therapy. We live in a culture of consumerism and neoliberalism, so be ready for that. And one of the things I always do is normalize that. Yeah, most people are very cautious about joining groups, but I also make the point that groups aren't second best. They're not a stopgap. We recommend groups because they can be more effective. And when inviting someone to a group, yes, I want them to be motivated. Yes, I want them to sign up to start the group, but they're not signing up for life. I invite them to come along and give it a go, and then it's kind of over to me and my co-facilitator to generate a group culture that kind of brings them in. Group space is limited and valuable, so don't offer groups because there's nothing else available. Also, our CAMHS groups are intervention groups, so they're about invitations to change. They're not support groups. There should be motivation to give it a go, and also support with attendance. Now, in terms of parents and carers, they can find groups challenging too, but often for different reasons. So, in this next bit, I want you to understand what some of the challenges are for parents and carers, but also learn from what our experts by experience tell us. So, if you copy and paste that YouTube link and go to 4:43 in the interview, and then the invitation is to watch that clip for 2 minutes, so till about 6 minutes and 50 seconds. And as you're watching it, an invitation to answer 2 questions. First of all, what were the barriers for this parent in terms of joining the group? And how did the group help this parent overcome them? So about 4 years ago, when we were developing governance and support arrangements about groups, what we didn't want to do was write a whole load of new regulations and new paperwork for group workers, because group workers already have loads of work to do, and if we're going to create additional admin burden, they might just put them off doing it. So our starting point was wanting to support group workers, which is why we produced this group work toolkit that is kind of on the shared drive, that gives suggestions about what you can do to meet some of the standards of good group work, which I'll share with you in a minute. At the start of that group work toolkit is a poem we came across that to me captures some of the ethics of group work, and I kind of invite you now just to pause before the next slide and have a read through that poem and see if it chimes with your ideas about group work. So as I said, when we were developing the governance of groups in CAMHS, we wanted really clear message about what good group work looks like. And for us, this was about the group being evaluated, supervised, effective, participant informed, and responsive to clinical need. What we didn't want to produce was a big fat document that sat on a shelf somewhere that no one would read. So we produced this quality assessment checklist, the QAC. And the idea with the QAC is that a group worker could look through the different categories and see how their group was doing, but it could be done quite rapidly. So it was a quick QAC. And you'll notice there's 3 levels. Yes, there's a level 2 is the CAMHS minimum standard, so we would hope all our groups meet level 1 and level 2. But we also wanted to include an aspirational standard, that's level 3. And that's because of the research from Michael West, and what he showed was that unless NHS care is continually trying to improve, it declines. The QAC has now been evaluated by Surrey University, and have a look at it, see how it maps onto your group. Any questions about it, please get in touch with me. My email address is at the start of this presentation. And so to finish, thank you for your time. I'm going to end with a non-randomly selected quote from somebody that's joined one of our groups. And yeah, please keep in touch with other group workers moving online so we can share our experience and learning.